also want to express our gratitude to the people that invited us here to present our work today. I guess I didn't read the title, so I will. Intranasal administration of an RSV vaccine deficient in the M protein, we'll call that M-null RSV, protects infant baboons against an RSV challenge. This is me, this is Tom Omens, who developed this M-null RSV vaccine. Roman Wolf, James Papin, Alicia Prino are all veterinarians that work at the baboon colony. Vadim Ivanov is a neonatologist who did the pulmonary function test for us. Rachel Stotts is my awesome technician, and Tony Piedra, you know, but he ran the serology for us on this. So the M-null RSV vaccine, the RSV-M protein is responsible for reassembly of the virus after infection. M-null RSV is prepared by substitution of the green fluorescent protein open reading frame for the M open reading frame in the RSV genome. M-null RSV is grown in HEP2 cells that are transfected to express the M protein. In HEP2 cells, M-null RSV expresses the F protein on the cell surface, and in fact, it expresses all of the cell proteins except for the M. And M-null RSV in culture infects initially, but it can't reassemble, and so it doesn't spread beyond initial just simple fusion with neighboring cells. It doesn't reassemble and then get back into the fluid phase and infect other cells. In some preliminary studies, we looked at different doses of the vaccine and different routes of administration, either intratracheal, intranasal drops, intranasal sprays, and we found that if you gave it intratracheally, you actually got very good immune responses with a single dose, perhaps analogous to aerosol administration of the vaccine. If you gave intranasal sprays or drops, you didn't get a response with the first dose. But if you then gave a booster dose, you got very good antibody titers, really the same that we have after a lifetime of exposure to RSV. And so we chose this protocol for the vaccination program. So we vaccinated 14-day-old baboons with 10 to the 7th units of M-null RSV or a placebo, both of these grown in HEP2 cells. Priming vaccination was done by 3 intranasal sprays. We know they only have 2 nares, but we wanted to get 1 ml in, so we used 0.3 to 0.4, and the animal is completely awake while this is being done. A booster dose was given at 42 days of age. They were challenged on day 56, so 2 weeks after the booster dose, with 8 times 10 to the 7th units of viro-grown RSV. That's study day 0. And these are grown in viro, these are grown in HEP2, so you have different cell types for the vaccine and for the challenge. They're intubated on study day 0, 4 to 5, 7 to 8, and 14 after challenge. And each of these days we did pulmonary function tests and also did bronchoalveolar lavage. Respiratory rates and level of activity were continuously monitored because we had infrared cameras on the cages, so you could follow breathing rates and levels of activity 24/7 and just get the values off the monitor. The endpoint is expressed as respiratory ratios, so some baboons are breathing 45 at 1 month of age, some are breathing 60. So we took the 3 days before challenge and averaged all the respiratory rates for that time period, made the baseline figure of that, and then after challenge we averaged all the respiratory rates for each individual day and made a ratio of that to the baseline figure. This is a graphic of the timeline. Born at day 0, priming vaccination at 14 days of age, booster vaccination 28 days later, and challenged 14 days after that. They were then intubated on day 0, day 4 to 5, day 7 to 8, and day 14 after the challenge. And on each of the intubation days, we obtained blood gases, performed lung function, including work of breathing, lung compliance, and minute ventilation, and BAL for viral culture and white cell count. And then the animals were necropsied 14 days after the challenge. We also made an activity score, so if they got a score of 3 if they had vigorous, quick movements, were leaping, climbing, hanging from the roof of the cage as they do, all the way down to 0 points for lying on the cage floor, having minimal activity, and not taking food or formula. So these are the data. This is the respiratory ratios, and this respiratory ratio on the vertical axis and study day on the horizontal axis. We did all the animals in pairs, so we took 1 unvaccinated animal, 1 vaccinated animal, ran them together. They got the same lot of virus and had all the other same techniques on a given day. The unvaccinated animal in this first pair started breathing quickly immediately, had a peak of respiratory rate on about day 5 or 6, and then declined after that. Vaccinated animal also developed some rapid breathing there were 3 days in which they had increased rates of breathing. but in all cases less. And if you did statistical significance, you find that the respiratory rates were higher in the unvaccinated than in the vaccinated animals. Second pair, basically the same thing. The unvaccinated animals started breathing quickly almost immediately and continued to breathe rapidly after that and then declined. The unvaccinated animals had just a couple of days where they had increased respiratory rates. This is the third pair, and we did not find a difference in outcome here. The vaccinated animals started breathing fast early on and then declined. The unvaccinated animals had an increase in breathing after that and remained above the vaccinated animals for some period of time after that, but not a statistically significant difference. At this point, we realized that the vaccine had been sitting in the freezer for 2 years, and so we got a fresh batch of vaccine made and administered that to the fourth pair. And the unvaccinated animal again started breathing quickly and sustained that for several days. By day 6, he was breathing 150 times a minute, where normal is 45 to 50. He was obviously wheezing when you listened to him. Wasn't taking any fluids in, was lying on the cage floor. We gave him a normal saline infusion, which really didn't help. And the opinion of everybody involved was that this animal was moribund, and so he was euthanized at that point. At the same time, the vaccinated animal had 2 days where there was an increased respiratory rate and then recovered fairly quickly after that. This slide shows the viral burden. This is by culture, so it's platforming units in BAL fluid on day 5, which we know is the peak of replication. And you can see that in all 4 pairs, the vaccinated animals in orange had lower viral burdens than the unvaccinated animals in blue. It's probably worth noting that we usually get around 10 to the 4th platforming units per ml back. This particularly ill animal had 10 to the 6th platforming units in their BAL. These are the activity scores, and you can see that in the first pair, the vaccinated animal maintained normal levels of activity throughout. The unvaccinated animal had 3 days with lower activity levels. In the second pair, there wasn't much difference. The vaccinated animals most of the time had normal levels of activity, so did the unvaccinated animals. There were just 2 or 3 days per animal that they had even a mild reduction in the amount of activity. This is the third pair where we didn't see a difference in respiratory rates, but you can see that the unvaccinated animals had much lower illness scores much more often than the vaccinated animals did, even though the respiratory rates were the same. And then this is the fourth pair where the unvaccinated animal had a precipitous drop in level of activity and was euthanized on day 6, whereas the vaccinated animal had a normal level of activity throughout the entire period of time. This is the histopathology in the animal pairs, and I just showed this to represent the first 3 pairs. We tried to take the most abnormal area of the lung, abnormal-looking area of the lung, and make histology from that. Most of the unvaccinated animals had a few areas of consolidation. The unvaccinated animals did indeed have interstitial pneumonia, but not to the same degree as the unvaccinated animals did. And then this is the fourth pair where this animal was particularly ill, the unvaccinated animal. And you can see these are the alveoli, and they're filled with this edema fluid and inflammatory cells. And you can see some syncytia formation here in a couple of areas of the lung. And this is a bronchiole from that animal. And you can see it's plugged with this fibrous material and also with inflammatory cells. And this is the vaccinated animal from that same pair. Again, some interstitial infiltration, but obviously quite a bit different than the more seriously ill animal. So in summary, intranasal priming and boosting of baboons with M-null RSV beginning at 2 weeks of age reduced the respiratory rates following RSV challenge. Is a probability value of 0.024 for the entire group of 4 pairs. Reduced viral replication in BAL fluid following RSV challenge, again statistically significant reduction. Resulted in improved overall activity of the baboons following RSV challenge, may have prevented 1 RSV-related death. And it generated reductions in lung histopathology. The findings were, as you saw for most of the animals, not particularly striking. I would point out that the necropsies were done on day 14, and the animals usually had returned to normal health by about a week before that, so that might have blurred some differences that might have been there. And the intranasal route of administration avoids potential problems associated with injectable RSV vaccines. And further steps, where would we go from here? Perhaps increase the content of prefusion F in the M-null RSV. It's all post-fusion at this point, so you might get better neutralizing responses if we incorporated some prefusion F into that. Reduce the titer of the challenge dose. They currently get 8 times 10 to the 7th plaque forming units, and this could be higher than any vaccine could protect you against. Determine the relative importance of serum and secretory antibody and CMI if we did a large enough group of animals. Investigate the feasibility of administration by aerosol because there was a strong antibody response after just one dose where we used 2 doses in the intranasal protocol. And in a parallel study, evaluate the immunogenicity and protective efficacy of MNL-RSV in elderly baboons, which is another area where an RSV vaccine might be useful. So that's what I have to say, and thank you for your attention.
Thank you, Bob. That was very nice. So when you administer any hints of any side effects or any issues on the tolerability of the vaccine into the vaccinate?
Yes, certainly. So you're putting a live vaccine in. You want to make sure that nothing bad happens from that. So certainly no changes in pulmonary function, no changes in oxygenation, and we're still looking at the inflammatory cells, and I can't really tell you how that changed at this point, but it looked pretty good from that standpoint.
So you put the 14 days in the context of human infants with the lifespan of the baboons. What is the equivalent? What do you think?
So that's a great question. I don't think anybody knows the answer to that. I've read considerably about what people have done in terms of trying to determine how immunologically competent a 2-week-old baboon is, and there's really no correlation with it. Yeah, there's no data to say where you are as far as that's concerned.
So indeed, great stuff. Have you blinded your study, and if not, would you think it would be valuable in your future studies, as we do in humans, to blind the caregivers?
It's completely blinded. There's only one person that knows a group assignment, and she doesn't talk, and she has a poker face. You can't figure it out. Try as you might, you can't get it.
Thank you, Bob.